A bad start to the year for Gauteng as the province's emergency services confirm a number of suicide attempts on New Year's Eve. The Gauteng Health Department has sounded an alarm on this, saying the majority of those attempts come from the city of Ekurhuleni and parts of Beggersdal. Now, for more on the story, I'm joined by Gauteng Health MEC Nomantu Nkomo-Ralehoko. MEC, thank you so much for your time this afternoon and for joining us. Now, the province received over 1,500 incidents reports, and most of these were for suicide attempts. Compared to previous years, how dire is the situation in the end of 2023?
We did receive some of the calls, indeed, the call centers that were related to suicide, but we had 42 cases that have been recorded that are specifically for suicide. But now there is a slight decrease, which we really were happy when you get that, because last year it was 53 in terms of those that we received on the day, which is the New Year's Eve, by the way. So at least we're saying at least there's an attempt that they are going down. Besides that, other cases were on trauma cases, on medical, on accidents, as we indicated lastly. But it was a number that we picked it up even on that day, that there are these calls that are specifically dealing with suicide attempts. But again, what we are doing now, because we are working very closely with other NGOs, like your South African Depression and Anxiety Group. They are assisting us, and they were indicating that 23 suicide cases were recorded per day, in some cases on their stats that they are giving us, and 230 serious attempts are in South Africa. So it's just the overall amount that they were giving us here.
230 serious attempts is quite a number, MEC. What socioeconomic factors do you believe contributes to this plight of suicides and attempts?
Part of the issues is mental disorder. It's financial problems that people are experiencing, and trauma-related experiences such as rape and other accidents that happened. Some of those, because it's young people, it's failure of those kids on the exams, and that's another thing that has been contributing.
And I just wanted to ask, you mentioned the young kids. Did you see within that number of 42 that was recorded, is it mainly the younger generation or those that are much older?
Indeed, there is a younger generation that are there, that have been there, because there is a recent case that I was indicating even yesterday of a 14-year-old that was in Garankuwa that was attempting. So quite a number of them that have these attempts, and then sometimes we are able to assist them in the hospitals and in the communities where they are. So young people, indeed, they are involved, which means we need to work very closely with the Department of Social Development and Department of Education in ensuring that some of these things we are able to deal with them immediately.
What would you highlight as your department's challenges in averting and assisting those, especially when it comes to the scourge of suicides and the attempts of suicide?
As a department, we have been working very closely with, collaborating with the Department of Social Development. We have an integrated intervention that we're coming up with. In fact, we will, even during this January now, on the Back to School campaign, we will still be talking about some of the interventions that we need to do with our colleagues. Because the challenge, again, that we have picked it up is the teenage pregnancy. That is becoming another problem, that when these children are involved in those things, we need to support them so that they don't end up killing themselves because of the frustrations that they are having. Even today, we are having a discussion document that will be presented to me that is going to talk on some of the areas that we need to look into and present that document to the colleagues in the department and in the Department of Social Development. So we're working very closely with the Department of Social Development because we believe that will help us as a department too.
MEC, you speak of collaborations with NGOs, the Department of Social Development, as well as SADC. Are there facilities that people in Gauteng can actually go to beyond calling the call center if they are in need of such help?
At the moment, I think we'll forward that information to you of which areas that the Department of Social Development is having those facilities on their side. On us, you can just go to any of our healthcare centers even in the hospital or in our clinics, we are able to accommodate you when you come there in terms of having a social worker that is there that will talk to you. In every hospital, we have a social worker that is there. But again, we have established youth zones in our communities. So those youth zones, we find young people that are able to talk to those that are young and address them and support them, because it's more about supporting each other that we are emphasizing to the colleagues that are operating at the youth centers and youth zones that we have established as a department.
Of course, you speak of support, MEC, and it's quite important that government has established these relationships and facilities in order for people to be able to get support. But I'm sure the communities themselves have a responsibility towards each other with regards to supporting. What plea would you have to communities, especially during this time of the year, in terms of parents supporting children who possibly have failed, or whoever's going through certain mental issues, in order for them to be able to get assistance from the communities themselves?
We want to encourage the communities to work very closely with our citizens and our children too, and our government departments, because we need to collaborate indeed, but we need to make sure that every issue is a societal issue, not isolated this incident. So we need our involvement of all the sectors beyond government. We need our faith-based organizations to work very closely with us, our traditional authorities in areas where we have them, our civil society organizations that are even part of the department, both the Department of Health and the Department of Social Welfare, because we are sharing stakeholders. So those stakeholders must come on board and assist us, because this is a crisis that we need to respond, all of us, to it.
And lastly, MEC, are you looking to ramp up any of your campaigns with regards to awareness, especially when it comes to suicides?
We will. In fact, we are starting it. We're not going to ramp it up now. We will be starting it immediately when we have that back-to-school program. We will definitely involve yourselves and talk to you so that you are able to spread the gospel to other communities about the work that we are going to do as a Department of Health with other colleagues from other departments that I've indicated already. Because we are going to do a lot of work on this. There is a program of action that is going to be presented this afternoon to myself by the department that will talk to these specific issues that we have identified that we need assistance on, working with these colleagues from the other areas. And our facilities, we're going to strengthen our facilities and ensure that now there is more work that the social workers are doing, working with other social workers from other departments like the Department of Social Welfare.
All right, MEC, thank you so much for your time this afternoon. A happy new year to you, and we certainly do hope that a lot more of your work will reach those that are in need. Thank you so much for joining us this afternoon. That's Gauteng Health MEC Nomantu Nkomo-Ralehoko speaking to us there about the increased numbers of suicide attempts in the province.